Welcome to Module 1, the who, what, where, when, and why of hand hygiene reviews. At the end of this module, you should be able to explain the importance of hand hygiene, understand why we perform hand hygiene reviews and who performs them, explain where and when we perform hand hygiene reviews. In the 2015-2016 fiscal year, there were 631 hospital-acquired MRSA cases, including 141 hospital-acquired MRSA infections in Alberta. In the same time frame, there were 1,082 hospital-acquired C. diff cases. Of those patients, 39, or 3.6%, died due to direct or indirect results of C. diff. Hand hygiene is the single most effective way to prevent and control the spread of healthcare-associated infections in our healthcare facilities. Healthcare-associated infections cause unnecessary stress and hardship on the patients and their families. AHS recognizes that hand hygiene is a shared responsibility. All staff, medical staff, and volunteers play a role in patient safety. The primary purpose of collecting data on hand hygiene is to help provide a measure of healthcare providers' hand hygiene compliance. We can use this information to increase staff understanding about the importance of hand hygiene, measure the effectiveness of hand hygiene improvement efforts, understand barriers to hand hygiene and use this information to develop action plans to increase compliance, reinforce AHS's commitment to and expectations regarding hand hygiene, celebrate success stories, and improve efforts. Furthermore, hand hygiene education and training, as well as the collection of and the reporting on hand hygiene data, are a required organizational practice set out by Accreditation Canada. Alberta Health Services includes hand hygiene as one of the 17 performance measures reported publicly to Albertans. Hand hygiene reviewers can be any AHS staff member. Anyone who wishes to perform hand hygiene reviews must complete the hand hygiene reviewer training. There are two types of hand hygiene reviewers: IPC reviewers and site-based reviewers. The IPC reviewers provide support to sites and assist with training and mentoring of the site-based reviewers. The IPC reviewers' hand hygiene reviews are used as a comparative to ensure accuracy of data collection by site-based reviewers. These reviews are supplementary to the site-based reviews. The site-based reviewer performs hand hygiene reviews for their site or unit. They are responsible for meeting their site or unit's base target number of observations. It is important that the site-based reviewers work with the IPC reviewers and the hand hygiene project managers so that the reviews flow smoothly and are consistent. The hand hygiene project managers work in collaboration to support the IPC reviewers and others within the zone on hand hygiene improvement initiatives. All staff within a healthcare facility can be observed during a hand hygiene review. This includes medical staff, volunteers, students, and contracted staff. Patients and visitors cannot be observed. This includes family members and friends. Reviews can be performed within any inpatient or outpatient setting where AHS services are being delivered. Reviews can be performed when a healthcare provider interacts with a patient or patient's environment in the context of the 4 moments of hand hygiene. Keep in mind, you should not record any observations during a medical code or a crisis situation. During a medical code or crisis, it is more important for the healthcare providers to focus on the medical code or crisis occurring. In summary, you should now be able to explain the importance of hand hygiene, understand why we perform hand hygiene reviews and who performs them, and explain when and where we perform hand hygiene reviews. You have now completed Module 1. You are now ready to begin Module 2.